So, good afternoon, everyone. My name is James, and welcome to the My Health Record via Conformant software e-case, or as some of you may know it as Healthmetrics. I'm joined today by Alex Dolezal, who is the acting digital health manager, and Patrick Nicholas, who is the product manager at e-case.
Guys.
Before we start, I'd like to acknowledge the traditional owners. So Central and Eastern Sydney PHN acknowledges the Aboriginal and Torres Strait Islander peoples of this nation. We acknowledge the traditional custodians and sovereign people of the land across which we work. We recognize their continuing connection to the land, water, and community, and pay respect to elders past, present, and emerging. So this is just a brief agenda for today's presentation. And just a couple of housekeeping for today. So you can ask questions throughout the presentation. So you can use the chat box or the Q&A function, or alternatively, you can raise your hand and we'll unmute you. Please keep your mics on mute throughout the presentation to avoid any interruption. The webinar will be recorded today and posted on YouTube. And also, please complete the evaluation at the end. This is crucial in providing feedback for the running of future webinars. Just a quick little introduction to Patrick. So Patrick Nicholas is a digital health leader with 2 decades of experience, including the past 10 years focused on aged care software, product, and project management. As a product manager for residential care and retirement living at eCase, Patrick is passionate about designing solutions that streamline workflows and boost efficiency for aged care providers and workforce. When he's not driving innovation in digital health, Patrick enjoys spending time with his 2 young daughters, cycling around Melbourne, and playing with the drums. And I will now hand over to Alex to continue the presentation.
Thank you, James. Good afternoon, everyone. Before we hand over to Patrick for the interactive demonstration, let me provide you with more information regarding the My Health Record system. So first, let me cover the learning outcomes for this webinar. So number 1 is describe the My Health Record system, its benefits to aged care residents and what it contains, the various documents. Outline how healthcare providers and residents can access the My Health Record system. Describe the security and privacy of the My Health Record system. Outline how an organization can register to use My Health Record system. Outline an example journey of aged care resident and their healthcare provider using My Health Record. Now, I might use resident and consumer and patient during this presentation. Patient would be in the general practice setting, resident would be in aged care setting, consumer will be in obviously consumer settings, but I might just use these interchangeably during the presentation. Next slide, please. So, what is My Health Record? My Health Record system is a secure online summary of an individual key health information. It is personally controlled. This means an individual has say on what gets uploaded and what stays in their record, and also who can access their record. More importantly, it is part of a national system. So an individual's My Health Record travels with them wherever they are, wherever they go, no matter which healthcare provider they are seeing. My Health Record is always accessible by the patient, resident, their representative, and their healthcare provider. And My Health Record can be viewed and information added, but again, it is subject to access controls by the patient. We will cover this later. So, what do healthcare organizations need to do to register for the My Health Record system? So first, even before you start registering, you should consider developing My Health Record security and access policy, which will outline who in your organization can access My Health Record and under what circumstances. Then you would register for My Health Record. There's various ways of doing this. You can either use Proda and do it yourselves, or you can reach out to your PHN. or you can also reach out to the Digital Health Agency. You will set up access and train your staff so they are familiar with policies in place. And obviously, you would train them also in the software. So, for example, eCase, which Patrick will demonstrate later today. And you would confirm the process to access my health record for authorized staff who can access and again under what circumstances. Determine the ongoing participation and obligations. So patient consent and only accessing my health record for work purposes. Some of these we will cover later. Now I will mention some statistics. You can see these on the slides. So currently there are more than 24 million my health records in Australia, which contain information, and 7.58 million are in New South Wales. 1.7 million documents have been uploaded by consumers or healthcare providers. Most are clinical documents, and some of these will be discussed later in the presentation. So now some statistics on healthcare providers and the registration and participation in my health record system. 99% of general practices and pharmacies are registered for my health record system and actively using my health record system. 97% of public hospitals are registered and using. And at the current time, only 43% of residential aged care homes are registered. We are actively working in increasing this statistic. And on the right, you can see a summary of how healthcare providers are uploading or viewing other documents uploaded by different healthcare professionals. I will now describe the types of my health record documents. So there are many types of documents which can be accessed or uploaded to my health record system, which include three broad categories. Healthcare provider documents, these are shared health summaries, mainly uploaded via general practice software, discharge summaries which come from the hospitals, residential aged care transfer summary that would be uploaded in the residential aged care setting, and others. There is also consumer entered information, for example, emergency contacts or advanced care planning documents, and Medicare information that's pulled from the Medicare databases, and that would include prescription information, information from the Australian Immunisation Register, and also MBS information. Patrick will cover some of these in his interactive presentation after I conclude. So, what are the benefits of my health record system? The potential benefits of my health record include three key areas: the overall health sector, at the healthcare provider organization level, and at the consumer level. The benefits for the health sector include improve continuity of care and reduce the duplication of services. So, for example, you can check which pathology tests your resident already had, and you do not have to order them. The benefits for the healthcare professional like yourselves include improved access to information, such as immunization or discharge summaries. And the benefits for the resident include improved access to key health information in emergency and informed self-management. So as I mentioned before, they can add emergency contacts. High value functions of my health record system in the residential aged care home setting. On this slide, you can see an example of how the my health record functions align with the clinical function in the aged care settings. So my health record supports clinical functions by providing access to immunization and medical information, discharge summaries, investigation and imaging reports and advanced care plans. There's other documents as well. So these function enhance medication management, patient transfers, and decision making while reducing duplication and improve the quality of care. How can consumers access their own My Health record? There's actually two ways of doing it. Consumers can log into MyGov if they're registered and use the My Health record function to view, download, and enter information. And there is also the My Health app. Consumers can download My Health app from the App Store, and this would allow them to have it on the mobile phone or mobile device, take it around, view and download documents, add information, and also show to the healthcare professional and share this information with the healthcare professional. How can healthcare providers access My Health record? So healthcare providers can access again in two ways. They would either access My Health record via Conformant software. In aged care settings, example of this software would include eCase, but also other software products. And we will have a slide on those other software products. In general practice, for the general practitioners attending, this would include general practice software such as Best Practice or Medical Director and others. If your aged care home or any setting for that matter does not use Conformant software, you can still use the National Provider Portal, which is pictured on the right side of the slide. This is a viewing platform only, and you can access it via a web browser. While the National Provider Portal is limited to only viewing, it is highly valuable because it provides an insight into your patient's medical history. You can't add information, but you can still look up your patient's immunization history, discharge summaries, etc. Now, this is the slide which I mentioned earlier, the Conformant software for residential aged care homes. Accessing your resident's My Health record to view. So a registered healthcare provider can access My Health record for the purpose of providing care. A provider is authorized by law without seeking permission to view My Health record in the following circumstances. The provider is authorized by the healthcare organization to access My Health record. The provider is providing care to the patient. However, it would be still best practice to discuss with the patient about accessing their My Health record in case of any sensitive documents and information. Accessing your resident's My Health records to upload. So a registered provider is again authorized to upload except in certain circumstances. And those circumstances would include the patient does not want document to be uploaded. First time uploading shared health summary. The shared health summary includes 4 key pieces of medical information, including allergies, past medical history, medicine information, and immunizations. And that's typically uploaded in the general practice setting. That should be agreed on with the patient. And then there are certain state or territory laws which require consent to upload sensitive information. So, for example, some pathology results for certain sensitive conditions. Privacy and access control settings. So a patient can choose to restrict access to My Health record. It is fully personally controlled. A patient can choose to restrict access to specific documents in their My Health record by using the limited document access code. They can restrict the entire record using a record access code, or they can also remove documents and set up alerts when health provider accesses their record. So for example, they can receive an SMS or an email message whenever any healthcare professional accesses the My Health record. There is an exception to this. It's called emergency access provision, or also the emergency, the break the glass functionality. So emergency access provision can be used in cases where there is a serious threat to life, health, and safety. So, for example, the patient is unconscious or not in a state to consent to the use of My Health record, and they do have one of those restrictions. It is not possible or unreasonable to obtain the consent of the patient. There is a serious threat to public health safety. I will mention the privacy and access settings for nominated representatives and later for the authorized representatives. So first, the nominated representatives. Nominated representatives can help access or manage your health information if you cannot. What your nominated representative can do in your records depends on the level of access you give them. You have complete control over what your nominated representative can see and enter in your record, and you will need to invite the individual you wish to be a nominated representative to give them access to your record. Now I will cover the same for authorized representatives. So authorized representatives are responsible for managing a record for someone who cannot manage their own, typically a parent, carer, family member, or someone with enduring power of attorney. A person who has parental responsibility, legal authority, or is otherwise authorized to act on individuals' behalf, and has complete access and control over their dependents' record, just as if the record was their own. And now I will hand over to Patrick for the interactive part of the demonstration. Thank you.
Thanks so much, Alex, and it's a pleasure to be here today to talk about My Health record access in eCase. So I'll just share my screen. Thumbs up if you can see that okay. Thanks, James. Today I'm going to cover the eCase side of things, and obviously for our aged care providers and people that are involved in providing care in an aged care setting and using eCase. So I'll just go through the My Health record overview in eCase, talk about the health identifier service and the importance of that, the role that plays in accessing the record. I'll go on how to request access to the eCase My Health record as well, which is important for those of you looking to get My Health record deployed as part of your eCase solution. I also talk about some group access. So Alex touched on a lot of those restrictions that can be put on a resident's My Health record. So talk about those and how you can apply some of the security in eCase. And of course, the demonstration of the module as well, and leave some time at the end for Q&A. Okay, so go to the next slide. Just an overview of My Health record and the module that exists in eCase at the moment. We're continually enhancing the product in eCase, but at this point we are conformant and have the following functionality in for My Health record. So we have, in terms of the viewing aspect of My Health record, we are able to access the prescription and dispense views, the pathology report view, diagnostic imaging, and also the document list, which has a range of documents that are uploaded either by the resident or other healthcare providers. So that includes your immunisation views, shared health summaries, discharge summaries, etc. So very, very rich information about the resident. For uploading to MHR and contributing from your aged care home into the resident's My Health record, we have the functionality to upload an advanced care plan. That's where our upload functionality is limited to at this point. And we found that that was the use case that had the most value in the aged care setting due to its role in end-of-life care. And we're actually working on right now, it's in development, is the aged care transfer summary, which is, I'll touch on a little bit later, but that's coming soon in 2025 to the product. Okay, so a little bit about the Health Identifier service. I'll refer to that as the HI service. So these identifiers you would have heard of, I'm sure, but they really are the foundation component of all national digital health products and services, including My Health Record. And the Health Identifier service is a national system for uniquely identifying healthcare providers. So that's where, say, a GP or a clinician, nurse, allied health would have their own HPII number, which is provided to them on registration. Healthcare organisations, that's HBIO, and the individual IHI number, which I'll go into a little bit of depth later. So these help and ensure individuals and healthcare providers have the confidence that the right information is associated with the right individual at a particular point in care. So every interaction from eCase or any of the Conformant software with My Health Record, there will always be an identifier to ensure that the right person's being talked about and communicated about between My Health Record and the associated system. Really important. I've just gone through the different types, but so that's IHI for the individual to confirm, HBII for the healthcare provider individual, like your specialist or your GP, allied health, etc. And then your organisation or your aged care home that you work for will have their own HBIO, which is the organisation health provider identifier. So these identifiers play a huge role in eCase and the My Health Record module. So there's certain data points that My Health Record uses and eCase uses to communicate to My Health Record. So for a resident, for example, I won't be able to look at any resident My Health Record data without the resident's IHI existing in eCase. And the way that we go and do that and go and fetch that identifier from the service, the HI service, is by putting in a first name, last name, a date of birth, and a Medicare number or a DVA number. That's the 4 points of ID or points of identification to identify that resident. And when you either add a resident with that information or even update their profile within the resident profile, the IHI number will come in to eCase and be stored. And then you'll be able to, if you've got access that My Health Record for the resident. With the HPII, the second point here, so that's for your staff or eCase users that are coming in and accessing the My Health Record. So I'll go into that a little bit later on how staff access, but if an organisation wants to give a user access to upload to My Health Record, and HPII will be required. So this is the upload side. And what we use there to validate that, if you're on a staff profile and you have your first name, last name, date of birth, and an APRA number, which is recommended, or an address, we will go away and bring that number in without having to type it in to eCase. That's the second point. And the third, which is the HBIO, we actually deploy that when you go live with My Health Record in eCase. Our service desk will take that HBIO and deploy it with the module, so you won't need to always add that in each time or add that. It's just done once. Okay.
Sorry, Patrick, we just had a question. It was just from Susie. She said, what if someone does not have Medicare or DVA?
Okay. Yep. So at the moment, yes, we do require that identifier. So there's no other way we can fetch that information. Yes, that's the current functionality. Yeah, but I can see there'd be a use case there for internationals or yeah, people that don't have that form of ID. Yeah, but for the moment, it's yeah, we require those 4 points in order to bring the HB, so the IHI number in. Thanks, Susie. Okay, so as an organisation, if you're a client of eCase, you're running the eCase software, and you're interested in deploying or having access to My Health Record via eCase, there's some steps to go through, and which Alex touched on a little bit earlier, which is contacting the Australian Digital Health Agency and requesting a NASH certificate. And once you have that certificate, you can send that through to our support team, along with the organisation HPIO number. And Australian Digital Health Agency and your PHN network can help you out with yeah, some of this training, particularly ADHA, can help with getting you set up. And there's, if you go to their website, there's a whole range of information and webinars as well to help you with gaining this information. Once our support team have those identifiers and certificates, we can deploy MHR or My Health Record into your eCase, and we have a way there. Then once you have that set up, you can go and fetch each of the staff members or residents identifiers and bring them into eCase. And as I said earlier, if you are planning as an organisation to upload to My Health Record, the user must have an HBII number in order to do the upload side. It's just something to keep in mind. Next slide here. There's a few pre-go live policies and procedures, and Alex touched on these earlier, where you want to ensure that the correct training program is in place, the correct security group and access is set up. But one of the important ones that a lot of customers ask us is, you know, do we have to have upload access, or, you know, can we just have view access for our staff? And the majority at this point are going with just view, especially as a stage 1 implementation, so that there's, you know, that an easier sort of implementation. There's no need to enter the staff HPII numbers, because with view access, all you require is just the usual eCase security access. So that's a good way to start, just to view. And then, you know, as a phase 2 in implementation, you can add on that upload factor as well. So every user that accesses My Health Record, it's recommended that you put a access group security in place. So that's what you see on the right-hand side here. This organisation set up a security access group called My Health Record, and that gives all the IHI and View My Health Record access. And it's recommended that once someone receives their training, they can then be added to this access group, and which would allow them access into My Health Record. Okay, yep, that's a couple of things to consider pre-go live. And also the conversation with residents as well is really important to ensure that you know, they're happy for the organisation to view and upload as well. Okay, so now I'm just going to take you through a brief demonstration of the My Health Record module. So I'll just bring up for you eCase. Okay, so today, probably the best way to take you all through the eCase My Health Record flow is to take a bit of a persona of, so I'd make myself a clinical manager. So I'm going to go in, and I've got, my name's Alice, obviously, and I have a new staff member that's coming on board, and his name is Alan. He's an RN, and he's recently received his My Health Record training. So he's ready to be given his view and upload access. And as an organisation, we've decided that we will upload and contribute the advanced care plan to My Health Record. So I'll just take you through how, as a clinical manager, I would go in and assign Alan, who's a new RN, to the access and also to validate his HBII. I'll log in as Alice. So someone like Alice is more of a super user, and he's got quite a few menus there access to. One of them is called User Group, and on this screen I'd be able to search for Alan, the new RN, and I'm really keen to give Alan access to, firstly, the My Health Record group, and this will give him view access to My Health Record. Just find that setting there, that's the one. So now Alan is a care RN, and he's also has access to My Health Record. And next step would be, because Alan's going to be contributing an advanced care plan to resident profiles and to resident My Health Record, he'd need his HBII number to be added to eCase. So what I'll do is I'll flick back to the search for a staff member called Alan. Click on search there. Go into Alan's profile, and you can see down on the bottom of the screen here an HBII number. So that's currently blank, but what I need to do is put in those 4 points of identification. So I've got Alan's first name, I've got his last name, his date of birth is incorrect at the moment. I need to change that to the 20th of December. And I'll put in his APRA number, which is, test 2480. Click update, and that will go away to the Health Identifier service, pick up Alan's HBII, and bring that back in to eCase. That's now populated, and it's got the date that it was added and the time. And that's done every time there's an update to this screen, on the demographic screen. The eCase will go and validate that HBII to ensure it's common and current. Okay, so now that that's complete for Alan, I'll be able to jump into any resident. So I can now go into, let's say, Faye. She's at the capital city. Here's Faye's profile, and you can see now, if I just go across a little bit on the top banner, I've got access to a My Health Record tab in eCase. So if I click into that, that goes away. It's connecting now, meaning that it's saying, okay, I have an IHI for Faye, which is this number here, which has been validated on Faye's demographic page. And the person who is accessing has the correct access, so the My Health Record group access. And I'm going to show Faye's record in eCase. So these are all of the documents, but from the top of the screen, you can see we've got Faye's photo, her name, date of birth, the facility that she's residing in, her wing, room and bed, her IHI number, and the status of those numbers, or that number. The two tick boxes here, so this tick box here means that Faye has given access via My Health Record. So if that was unticked, there would be, for example, Alex mentioned earlier, there's a record access code that you can restrict access by. So if Faye had that set up, none of this below information would show. It would just have this unticked, and I'd have to enter in there an access code and click gain, and then that access would load up this page using that code. That's for the scenario where a resident has put complete restriction on their My Health record, but it's available via an access code. If there was no code and no access, then nothing would show on the screen. But today, just for the webinar, Faye's given full access, and also because I've got an HPI number for the resident, for the user that's logged in. So for Alan, I've got the upload advanced care planning button here. So I can click that for upload, and I can just add in there my name and phone number and email. This is the author details that get sent with the advanced care plan that you're uploading. Put the date that the advanced care plan was uploaded. Choose a file. This comes in there, so ACP test. Has to be a PDF file. Click upload, and those details will be uploaded. I get the little banner there, and then just gets, just takes a bit of time. Be able to see that advanced care data there. So that's this one. That was 25th of June, 1:38. You can click on that, and it will open up the view, and you can then view that attachment, and that'll bring up the eCase advanced care plan that we have in eCase. So that can be any document, any PDF. So if you don't use the advanced care plan in eCase, then you can put any of the advanced care directives or care plans that you manage for your residents. Okay, that's for a user with an IHI. So resident with IHI, user has the HPII, they can upload. Just while I'm here, Alan, while he's doing his care, he's reviewing care plans, he wanting to look at some results. Faye has recently gone to hospital, so you can go down. I think I had a really good example here for discharge summary. This one was good, so I'll open up. Oops. Close that down first. Refresh. That's just reconnecting, one moment. Okay, go down to that discharge summary. There's quite a few documents on this page, and I can view that discharge summary for Faye, which gives a great overview, obviously, from the hospital, the primary diagnosis, secondary diagnoses, pathology test results while in hospital, chest X-ray, report, medications, etc. That's a really helpful view, especially in aged care setting when bringing someone back from hospital. If you just need a quick view of that, that's a great use case. The other one, the regular, is the immunisation view. So if I click on that one, well, yeah, another great view in aged care in order to ensure you've got all the Australian Immunisation Register immunisations that have been recorded. So you can see here, this resident, Faye, has had ADT booster, generic HIB, and a flu vax over the last sort of 13 years, but yes, old data, but it's yeah, very very handy information. Okay. We also have on the module here different views. So we've got a pathology view, a diagnostic imaging, and prescription and dispense. So Faye doesn't have any data in here. Before I jump to that, there's also, due to the fact that these document lists can get quite overwhelming and long, there is a filter option as well where you can filter by certain dates. If there's a certain document that you're looking for, like advanced care or shared health summaries, specialist letters, you can do a quick filter on that. And so, for example, if I click discharge summary, it'll refine that list and just show the discharge summaries, event summaries, similar again. I do have another resident called Morrison. There's some data in those other views I'd like to show. For pathology, for example, this gives a really good, just going to get this a little bit earlier with the data. So apply a filter there for a little bit more data, and I can see Matthew's pathology reports that have all been uploaded from South Australia Health, and gives you all those and has links in there to each one. So let's say hematology was uploaded, gives you the report on who uploaded that and when. You can click right in and see the results themselves just in this nice consolidated view. Also with the diagnostic imaging, so things like your CT scans, give you an example of that too. Just apply that filter, goes away and fetches some of the old CT scans. You can click a link here of a CT scan from Royal Brisbane and Women's Hospital. And you can go right in and see that report. Data. Okay. The last one was for Danielle Lamb, who has the last resident who has some prescription and dispense data. So I'll just look for Danielle in here. Moment. I'll just show the last view here is that prescription and dispense view. Very handy for seeing the medicines and medication chart. So I'll show the prescription and dispense view here for Danielle. And you can see and click into each of these medications and see the detail of dose and directions, quantity, etc. Okay. All right. That's basically concludes the demonstration of the product. One last thing I just wanted to show in the slides was what's coming next in eCase. And I touched on this earlier, which is the aged care transfer summary. And this has an excellent use case in the aged care setting because it's supporting the transfer of residents from aged care into the acute hospital setting with all of that key information that aged care facilities hold on their and homes hold on their residents, and they can communicate that into the hospital via My Health Record. So we're currently developing this functionality, and there's 3 documents that will be uploaded to My Health Record, and one is the health summary, which many of you would be very familiar with this report, which is our hospital transfer report. So that'll get automatically sent over to the hospital with the transfer, and a transfer reason, which I'll go into how that gets captured, and also a medication chart. If you have, say, a third-party electronic medication management system, you'll be able to download that from the third-party system and upload it through eCase with the health summary and transfer reason. So an example of what we're doing in this space is improving our movement out experience. So currently you click on the resident, you click into movement out, and you get a certain screen which is quite limited, and we can't capture as much information for the resident and the movement. So we are introducing a new drawer here where if you click movement out, you'll have all the same data points to collect, with a few additional items that will support the aged care transfer summary submission into My Health Record. So obviously you'd select the movement date, you would select from residential aged care, a temporary movement for hospital, and then you can select hospital from as the movement type. And then there's this additional step where you can choose the admission reason, and they can be configurable in your organization. But an example here is that it's an ED presentation, which we're going to also use for the quality indicator for hospitalisation down the track as well. But you capture the ED presentation, and then you can capture the additional comments, which will also form part of that aged care transfer summary and reason. And you can give the hospital a really specific and detailed reason on, why this resident is being admitted to hospital. So in this case, we put their resident has a fall and requires a neuro observation, and family's been advised. So that's when you click movement out on that screen, you'll then get a subsequent drawer that will pop out and say, sending this to My Health Record. It summarises the information that you've collected regarding the movement, so that it's a hospital, it's a temporary movement, it's an emergency department is the reason for the transfer, and the comments there, as I said earlier, that the neuro obs are required. The movement date obviously gets sent, and then it's the attachment. So we'll be sending the hospital transfer report, which gets automatically attached to this drawer here. And you'd have the option then to add a medication chart. So that's just taking a PDF chart of the resident's medications and uploading that into the drawer here. And then when you click send to My Health Record, all three of these pieces of information will get communicated as 3 separate documents through to My Health Record. That's our current development and where we're going with the next steps. And that basically concludes the demonstration. So if there's any questions, I'll be more than happy to answer those.
We just had 2 questions in the chat, Patrick. So we had one from Tracy. She said, further to the link she posted in the chat, she said, if you have an IHI, does that suffice even if a Medicare or DVA number doesn't exist?
Okay, so if you have the IHI, yep. Currently, you can't actually enter the IHI manually into your field, but that is something we can certainly consider if an IHI has been provided, but not a Medicare or DVA. But the current functionality is certainly, we preferred not to have to enter in that long string of a number, but because the Medicare and DVA were there, but I can understand that there could be a scenario where there is an IHI, so we can consider that. But thank you so much, Tracy.
We also had another question from Susan. So she said aged care needs to have this e-case software, right? A doctor can access to this e-case from online or need to upload to e-case.
Okay. Yeah, so there's around, we have a very large section of the aged care market that use eCase. There'll be many homes that use eCase, and a lot of those do provide access to their GPs and doctors via a login. So it's a cloud-hosted system, software. So you can access eCase from your doctor rooms if that's been agreed with the aged care facility. But yeah, if you've been set up and the aged care facility has given your access, appropriate access, and validated your HBII in the system, then yeah, you could potentially upload a advanced care plan, which is the only upload we're supporting at this point. But certainly to be able to view, you just need access to eCase with the username and password, which will be provided by the residential aged care home. If that answers your question. Yep.
I'll reshare the presentation slides. Okay, so just in the interest of time, we do have free online training and other resources, so you can access them via the Australian Digital Health Agency website. We also have our evaluation survey as well. So if you can please scan the QR code to access the evaluation survey for today's session, or alternatively, this will be emailed to you if you cannot complete it today. And just for future reference, so if you have any questions, or if you need any assistance with anything, we have all our details up here on the screen, so feel free to take a photo or a screenshot or anything. But yeah, so if anybody else has any other questions for Patrick or Alex in the meantime, feel free to ask them now or put them in the chat box. And yeah, we'll be online for another couple of minutes to see if anything else comes through.
Thanks so much, James. Appreciate the opportunity to present. I might just add there regarding the Australian Digital Health Agency. That's a really great resource, and they're always we're working closely with them and their education partners as well. But yeah, I really do recommend getting on their website and emailing those guys for any assistance at all with getting set up and any education needs as well.
There doesn't seem to be any other questions. Yeah, as previously mentioned, if you need to contact us at all, please use the contact details on the screen. I'd like to thank you, Patrick, for coming along and showing us how eCase works. It was a really great presentation. And thank you, Alex, as well, for presenting on my health record as well. Really great work.